Omar's beads are her life. She sells the richly coloured trinkets to buy food for her children and the drugs that keep her healthy. Omar is one of hundreds of thousands of Kenyans recovering from tuberculosis. She's alive thanks to a sophisticated screening and treatment program among the best in the developing world. She takes antiretrovirals for HIV, antibiotics for her TB.
I've accepted my status. The drugs have helped me regain my health and lead a normal life. People always say things about you, but I have to work. I have to fend for my children because I'm their only parent after their father died.
5 years ago, the Kenyan government decided to tackle TB head-on. It set up screening centres across the country, but it's come at considerable cost. For TB screening and treatment programs to be effective, there needs to be a complex network of support that includes things like supply chains for drugs and equipment, training for staff, and administrative backup. In short, it needs political will and money. For it to work, a TB screening program needs results fast, ideally within hours. That means a network of labs around the country able to process tests wherever the patients are. Through the early 2000s, Kenya's tuberculosis infection rate was rising by between 6 and 10% a year. It peaked in 2006 with 116,000 new cases. Last year it had fallen to 106,000, a significant turnaround that doctors also attribute to aggressive HIV screening.
HIV has been the main driver of the TB problem in Kenya, and therefore if you can take HIV out of the equation, the rates of TB will probably come down.
And there lies the social problem. Tuberculosis often appears in HIV patients, taking advantage of the weakened immune system. Because the two are so closely linked, TB takes on the stigma of HIV.
I have seen 2 patients.
The Pamoja TB support group was set up to tackle just that. The group of TB sufferers support one another and work hard to change public attitudes. They can't stop new TB cases, but they are breaking down barriers, and that ultimately saves lives. Greste, Al Jazeera, Nairobi.